Hey there, this is Dr. Casey Ashby again, an Adult and Pediatric Ear, Nose, and Throat here in Kalamazoo. I had a couple questions yesterday about sinuses. Actually, I think I got one question. Today I'll tell you a little bit about sinuses and what you can do about your sinus issues. Sinus problems, nasal problems are one of the most common issues that we see. A lot of people come in, they say they've just got a lot of congestion, pressure, drainage, stuffy nose, runny nose, postnasal drip. And, a lot of times the question is, what actually are the sinuses? The sinuses, which just about everybody has, are actually spaces within the bone of your skull. Most people have a pair of sinuses here called the frontal sinuses, a pair of sinuses in the cheek, those are called the maxillary sinuses. And then there's a row of sinuses right between your eyes that go all the way back to the middle of the head. Those are called the ethmoid sinuses. Right in the middle of your head, there is a space, a pair of sinuses called the sphenoid sinuses. So all of these are cavities, they're spaces within the bone. And they are all lined in what we call mucosa. Mucosa is the tissue that's on the inside of your nose. It makes mucus, very similar to the lining on the inside of your mouth. Now, it makes mucus, or snot, as we call it. Part of the purpose of the inside of your nose is to warm and humidify the air that we breathe. So when you're breathing in, your lungs do not like cold, dry air. So the whole part of the purpose of the nose is to warm and moisturize that air so that when it gets to your lungs, it's nice and warm and humid. Another portion that your nose provides to you is filtration. Everybody's spent a weekend cleaning out the garage or doing something really dirty and dusty. You blow your nose, you get a bunch of black crud and dirt that comes out there. So again, that's a big point that a big function that the nose serves is to filter the air that we breathe. Now the sinuses, there's been some debate about what their actual function is because some people, believe it or not, don't have certain sinuses. Some people will never develop these frontal sinuses and they get by just fine in life. There's no significant detriment to their quality of life or their sinus issues. They've just got two less sinuses that are going to potentially cause them problems later on. So, some of the theories are that potentially it alters the density of your skull, makes the skull lighter. Some of the theories are that it alters the sound of the voice and changes resonance. Whatever the case may be, everybody's got sinuses. Now, when we're dealing with stuffiness, congestion, facial pain and pressure due to sinus issues, or people with recurrent sinus issues, usually for most people, there's a couple of issues at play. One, it could be an allergic related issue. We see lots of people with allergies, either to the environmental things outside or inside. It could be trees, grass, weeds, dust, mold, pollen. And for some people, they notice certain times a year their symptoms flare up. For me personally, in the late summer, early fall, when the ragweed is in bloom, my allergies really significantly flare up. For some people, it's their pets at home. The cat might be sleeping in the bed or the dog in the bed. I personally am allergic to cats. For some reason, I've got a cat at home. The kids love the cat, so the cat stays. And daddy has his allergy problems. So oftentimes I will take a Claritin or Zyrtec. That helps kind of settle some of those symptoms. Now, if your allergies are really flared up and you're getting that sinus pain and pressure, there's a couple simple things that you can do. One is keeping the nasal passages clear. Something like a nasal saline spray can be very beneficial. Flush out the nose, clear things out. The nice thing about that, you can do it as much or as little as you like, just a saltwater mist. Now, if you want to take that a step further, something you can do is called the sinus rinse, or you've probably heard of a neti pot. What this is, there's a little squeeze bottle. You fill it with nice warm water. It's recommended that you sterilize it or use distilled water or boiled water so you don't end up with some sort of brain-eating amoeba, which is highly unlikely to happen. Then it comes with a little packet of salt. You put the salt in there, you mix it up, you hold your head over the sink, this thing goes in your nose, you squeeze gently, and it's actually going to start draining out the other side. You can flush both sides. You really want this water nice and warm. If it's cold, it's going to feel miserable. So you can do that as much or as little as you like. When I get a sinus infection, that's the first thing I do. Flush my nose, clear that stuff out of there. Oftentimes you can do that and not even need to be on antibiotics. Now, symptoms of a sinus infection. A lot of people say they've got a sinus infection. Oftentimes it starts out with a cold or their allergies flare up. A sinus infection typically is going to have a number of characteristics. One, you're going to have some significant nasal drainage. Your nose is going to be much runnier than usual. Usually there's some degree of color to it, either yellow or green. Usually there's some significant facial pain or pressure. Most people describe that pain and pressure in this area here or around the eyes, the what we call periorbital area. Some people will feel that pain or pressure in their upper teeth because the roots of the teeth extend very close to that sinus lining, so you can get a lot of sensitivity in the teeth. Now, you can get those symptoms just with a regular old cold. So we don't know for sure that it's a bacterial sinus infection unless it's been going on. Usually we say if it's been going on over a week and is not getting any better, or if it's getting worse at that point in time. Oh, we've got a special guest. It's Sasha.
Hello.
Hi, Sasha. It's Facebook.
Nice to meet you, Facebook.
It's 5 o'clock right now. It's about time to head home. It's a beautiful day. Okay, what else was I going to say? Sinus rinse, sinus infections, facial pain, pressure, congestion, drainage, postnasal drip, sometimes a fever, sometimes some significant fatigue. Okay, so let's say you've been doing your sinus flush, you're still not getting a whole lot better. Another thing you can add on to that regimen, a nasal steroid spray. The nasal steroid sprays are things like Flonase and Nasacort. Doing that on a daily basis, even if you don't have an infection, but you've just got some sinus pain and pressure or allergy symptoms, those are available over the counter. If you have that pain or pressure, the idea behind those steroid sprays is to reduce any inflammation at the drainage pathways, open things up, and get things to clear out. Now, that's not going to work right away. It takes about, I usually tell people 7 to 10 days before you even start to notice the benefits of those nasal sprays. So you have to be persistent. You're not going to spray it and notice any immediate benefit whatsoever. Oh, hi Matt. Hi Amber. Amber's supposed to be at work. Hopefully she punched out right now. I can hear her listening in the hallway. Anyhow. Okay, so the nasal steroid sprays, sinus irrigation, you can do an allergy pill. If it's really bad, you can do an over-the-counter Sudafed or a Claritin D with a decongestant. Quick disclaimer, none of this should be construed as medical advice for you. Always seek the advice of your doctor when you're dealing with your specific symptoms. Some people deal with this on a year-round basis. Doesn't matter what season it is, all year round, facial pain, pressure, congestion, and drainage. They've tried the nasal sprays, they've done the sinus irrigations. That's when sometimes we may need to step it up and do something a little more significant. Usually, that's the time people come and see us here, either myself or my partners, Dr. Barry or Dr. Shapiro, or our physician assistant, Martin. The next thing we will oftentimes do, if you've had no success with any of these, or you're getting recurring sinus infections, you're on multiple courses of antibiotics every year, usually we'll recommend checking you for allergies to see if that's an underlying component, which we do here via a skin test. Usually we'll recommend getting a scan of the sinuses, a CAT scan. That will allow us to see inside your head, X-ray vision. We can look at the sinus drainage passageways for the sinuses, see if there's a chronic infection, chronic inflammation. We can see if there's a blockage or a narrowing of the drainage pathways from the sinuses as they extend into the nasal passages. Oftentimes at that visit, we'll also look a little farther inside the nose with a little camera. It's not as bad as it sounds. We put a little numbing spray in there, can get a good look around, make sure there's no polyps in there causing obstruction. Next, if we see something significant going on, we may recommend further treatment, we may recommend doing allergy shots or the drops under the tongue. If it's something really severe, a chronic, really bad bacterial infection, or a ball of fungus in the sinuses, which we see fairly regularly, we may recommend something surgical. Surgery is usually a last resort for people. Now, we used to have to do all these surgeries in the operating room. You would go to sleep. While you were asleep, we would do surgery through the inside of the nose. Technology has changed significantly. There's now things that we can do here in the office to open and dilate the sinuses. There's something called balloon sinuplasty. What I might do is tomorrow I will kind of give you a little rundown on what balloon sinuplasty is. We've got a lot of very interesting devices, equipment. We've got a stereotactic CT scan navigation device that we use. So I'll give you a rundown on that tomorrow. In the meantime, if you guys have any further questions about sinuses or allergies or nasal congestion, please let me know, leave me a comment, and I'd be happy to address those for you, either in the comments or in tomorrow's video. Thanks, guys. Stay safe, stay home, wash your hands. We'll all get through this. This virus will not last forever, and we'll all be back to work soon. And thanks for watching. Have a good night.